and welcome back, Free From an Allergy community. It's my pleasure today to introduce the final session, which will be held by Marika Day. She's an accredited practicing dietitian and nutritionist with over 6 years of experience working with people who suffer from digestive illnesses and concerns. She now heads the new brand and program Gut Started, which aims to do nutrition differently, to reduce the confusion around nutrition and to make eating healthy fun, enjoyable, and simple. Her Gut Started IBS Control program has helped hundreds of men and women across Australia bring confidence back to their life, feeling free and in control of their digestive concerns. So thank you, Marika, for joining us today.
Thank you. Looking forward to doing this. Okay, so what we're going to go through today is managing irritable bowel syndrome, and we're going to touch on a little bit at the end of general gut health as well. So we're just going to go through the basics of irritable bowel syndrome and some of the strategies that I use both in the program and in clinic in managing IBS. So we'll move on to the next slide. So a little bit about me, as Lauren mentioned, I'm an accredited practicing dietitian nutritionist, and I've got this new brand called Gut Started, which is, like Lauren said, focused on doing nutrition differently and sort of having a really holistic approach to nutrition and empowering people with education, because one of the things that I've found in particular with IBS is when we know more about what's going on, we're more empowered to take put responsibility into making changes. So I think it's really, really important to have accurate information regarding your health conditions and what you can do about them, so that then you are motivated to sort of follow through with that. I'm actually a celiac myself, and I guess that was one of the reasons why I got into gut health and digestive issues and everything, is because I saw the profound impact that, you know, going gluten-free after being diagnosed had on both my physical and mental health. But also, again, one of the reasons why I find education so important is because when I was diagnosed with celiac disease, for me, learning about celiac disease was so important in my ability to now commit to a gluten-free diet strictly for life, because I know the dangers and the risks of obviously consuming gluten. So I think that that sort of transferred into my approach when it comes to nutrition in all aspects. Next slide. So what we're going to go through today is, first up, just a little bit about what is IBS, who gets it and why. We'll go through a little bit how IBS is diagnosed. That's the thing that a lot of people do still ask me is, what do I actually do to get diagnosed? What tests do I take? And then we'll go through lifestyle and diet therapy, and finishing off, like I said, with eating for a healthy gut. And if we've got time at the end, we'll do some questions as well. Next slide, sorry. Okay, so irritable bowel syndrome is a functional gut disorder. So what I mean by functional gut disorder is that there's nothing physically wrong when we are looking at the bowel. So when you have a colonoscopy, when you have an endoscopy done where they're putting a camera down your throat or up your rectum, there's nothing that the surgeons or the gastroenterologist can actually see physically wrong with your bowel. Usually your blood tests come back relatively normal as well. So it can be a really frustrating condition because it appears on the surface that there's nothing wrong. Now, that doesn't mean to say that there isn't anything wrong. What functional gut disorder means is that it's a disorder of the functioning of the gut. So the way that I like to frame this is that it's a disorder of gut-brain communication, so a disorder of the gut-brain axis. Essentially, what's happening is that the brain and the gut and the communication between those two has gone wrong somewhere. There's miscommunication happening. So the gut is telling the brain to do certain things, and the brain is telling the gut to do certain things in response to potentially quite normal stimuli. So, for example, when you're eating foods that we would consider most people to be able to tolerate, or volumes of food that we would consider most people will be able to tolerate, what we see in IBS is that they might not be able to tolerate it because of this miscommunication between the gut and the brain. IBS does tend to be more common in females. It's not to say that it doesn't occur in males, but it does tend to be more common in females. And it is a bit of a young person's condition in the sense that most people are diagnosed with it before the age of 50. We don't often see too many people diagnosed with it after the age of 50. And again, whether hormones, and menopause and everything have a role in that is quite possible. But it's just something that we do tend to see in younger people. It is a really common condition, and I think that this is a really important thing to remember is how common it is. So it's about, and the numbers vary, but it's about 1 in 7 people, about 30% of people in their lifetime will struggle with IBS at some point. So it is something that most people either have experienced in their life or know somebody who has experienced in their life. So it's really important, I think, to know that you are not alone with this, because it can feel so isolating when you're talking about symptoms that are related to your digestive health. You feel like you're the only one struggling with it. So the symptoms that we do see with irritable bowel syndrome are lower abdominal pain, altered bowel habits. So that might be constipation, it might be diarrhea, or it might be a combination of the both. Bloating or abdominal distension, so that feeling or looking like you are about 9 months pregnant when you are not pregnant. Excessive wind and indigestion. So indigestion could be reflux, or it could just be that uncomfortable feeling after eating. Go on to the next slide. Okay, so when it comes to the cause of irritable bowel syndrome, the specific cause of IBS is actually unknown. There's no pinpoint that we can sort of see that goes, when this happens, we develop IBS, or if this person eats this or experiences this, we know that they're going to get IBS. One of the things that we do see relatively common is what's called post-infectious IBS. So this is where somebody develops an infection, so a gut bug of some sort, so be it barley belly or something like that, where they've traveled and they've picked up a stomach bug. And what they find is that after that bug has sort of left their system and they've actually recovered from that bug, is that they then go on to develop IBS in the years afterwards. So this is what we would call post-infectious IBS. The good thing about post-infectious IBS is we typically see people recover from that more quickly than people who don't have post-infectious IBS. So normally in post-infectious IBS, we would see within a couple of years that people have no more IBS, essentially, so that they don't relapse again many years later. They tend to have a couple of years after, which is a long time, a couple of years after their infection, they have IBS, and then it does get better with time. Unfortunately, for other types of IBS, it can go on and off for the duration of a person's life. But the goal with our management of it is make it manageable and within your control, so that you know exactly what you can do about it, but we'll touch on that soon. The other things that I've got on this slide are not necessarily causes of IBS, but contributing factors to IBS. So what we've got there is altered GI motility. So this is just a change in the motility or movement of your bowel or your digestive tract. And so this is essentially a result of IBS, is that we see either the bowel is moving faster or slower. Number 2 there is visceral hypersensitivity. So what this means is where we have this increased sensation of our organs. So somebody with IBS tends to feel more what's going on with their internal organs, being their digestive tract, and all of the organs of the digestive tract. They tend to feel more of what's going on as opposed to somebody who doesn't have IBS. So a hypersensitivity there of the digestive tract, in that they can sense and feel these things more so. There's actually a really interesting study that is done on individuals with IBS, where they inflate a little balloon in the rectum of individuals with IBS and see what sort of response that we're getting in terms of a pain signal from these people. And so what they found is that when a balloon was inserted and inflated with a small volume of gas, is that pain sensation was increased. And this was even looking at pain centers in the brain they were lighting up more so than in an individual who doesn't have IBS. So it's really showing this hypersensitivity and this ability to feel even a normal volume of gas and sense that and signal that as pain to the brain. So yeah, this visceral hypersensitivity is really a hallmark of IBS. Past trauma is a really interesting one, and something that I am personally really interested in, because it's something that I've seen with a lot of people that I have worked with is past trauma or early childhood stress or chronic adult stress is the other one. Really, really common in individuals with irritable bowel syndrome. And when I speak about trauma here, it's not necessarily the big traumas that we all sort of tend to think of when we think about past traumas. It can be smaller things that have been exposed to us over a longer period of time. So the definition of trauma is not, these big events necessarily, but can be lots of little things over a period of time, which do build up to chronic adult stress. And this is something, like I said, that is seen a lot in irritable bowel syndrome. And then the final one there that I haven't touched on is genes. So we do see a bit of a genetic link in people with irritable bowel syndrome. I don't believe, and I might be wrong on this, I don't believe we've pulled out any specific genes that IBS, we know that if you have this gene that you're going to get IBS or that you're more likely to. But it does tend to have a hereditary nature to it, in the sense that if your parents have had it, then you are more likely to develop it at some point in your lifetime. And yeah, the last statement there is just, it's probably a combination of all of these things. So all of these things are sort of playing in together, and that's sort of causing the IBS. But like I said, we don't have a specific cause, so it can be frustrating again in that sense. Next slide. Okay, so how do we get diagnosed with IBS? Like I said, this is one of my most common questions, because I think it's one of those conditions where everybody sort of feels like, oh, I could have that. Like, I do feel this symptom from time to time. What do I actually do about it? And how important is it to get diagnosed? First things first, it is super important that you actually do get a proper diagnosis of IBS, because of the overlap we see of symptoms with many other conditions of the gastrointestinal tract, or outside the gastrointestinal tract as well. So it's really important that if you are experiencing symptoms of altered bowels, of bloating, of stomach pain or abdominal pain, that you do go see your GP in order to get an accurate diagnosis of IBS. Now, there is no tests that you can get done that are going to tell you whether you have IBS. The way that it's diagnosed is more so through a process of eliminating other conditions that might be causing those symptoms, and then based on criteria around your symptoms. So typically your doctor or GP will do some blood tests to check nutritional deficiencies, have a look at like whether you've got celiac disease, do your celiac screening, may, depending on your symptoms, ask you to go and get a colonoscopy or a gastroscopy, so where you're getting a camera down your throat or up through your bum. Not everyone will have all of those done, but most people will have at least a couple of those done in the process of elimination. What we always suggest, particularly being a dietitian, is to make sure that you don't make too many dietary changes prior to reaching out to your GP, because when you are getting the celiac screening done, it's really important that you have been consuming gluten in the month prior. So if you're sort of wondering about whether to eliminate gluten or not, the first thing to do is to go and get your celiac screening done from your GP, so that you can make sure that you don't have celiac disease before you just go and reduce your gluten in your diet. When it comes to red flags that we see in IBS, so these are symptoms that may give an indication that there might be something more than IBS going on. These things are unexplained weight loss, a family history of any inflammatory bowel diseases, so things like Crohn's disease, ulcerative colitis, or a family history of like bowel cancer or colon cancer. Any rectal bleeding, so blood when you're going to the bathroom, any fevers, nocturnal bowel movements, so where you are needing to go to the bathroom in the middle of the night, And like I said before, that age of onset after the age of 50. So you're older than 50 and you've got this sudden change in your bowels. All of these signs are things to go to your doctor as soon as you can to make sure that you're getting these extra tests done to rule out any more serious conditions that are going to need a different treatment approach to what we would do for IBS. So, for example, celiac disease, inflammatory bowel disease, colorectal cancer, ovarian cancers, these things obviously require very different treatment methods to irritable bowel syndrome. And what we don't want is somebody being treated as if they've got irritable bowel syndrome when there might be something else going on there. So it is really important to get that diagnosis done. Next slide. So this is the criteria that we use for the diagnostic, like one of the diagnostic tools for diagnosing irritable bowel syndrome. Now, it is done by a GP. You can't just go through and tick yourself the boxes and say, yes, I've got IBS, because like I said, you do need to get those other conditions ruled out prior. But essentially what it's showing here is that you, in the past 3 months, have had abdominal pain related to defecation, so bowel movements, a change in stool frequency, and a change in stool form or appearance. So it really is related to that abdominal pain, and then the changes in your bowel consistency or frequency. A lot of people ask me, well, I don't get the abdominal pain, but I have got diarrhea, or I've got bloating, or I've got constipation. What that might be then is not necessarily IBS, but it might be something like functional bloating or chronic constipation or chronic diarrhea. So it's treated a little bit differently to IBS might be, if there's no abdominal pain or cramping associated with it. So there's a few different functional gut disorders, IBS being one of them, that is really characterized by that abdominal pain and cramping. Next slide. Okay, so treatments for IBS. So we've got quite a few different approaches that we can go down for treating IBS. And the thing that I really want to drive home here is that there is no cure for IBS. I think there's a lot of people who have this belief that they can cure it and never experience it again. And I think that that's setting people up for failure, in the sense that it is a condition that may come and go for people's lifetime. And I think that by, again, knowing the facts around it, you can actually feel empowered by that rather than frustrated by it. And it's all about setting your expectations as well, and knowing that we can manage this, but there's still going to be times during your life where things might flare up. And I think that that is a better mindset to have than to think, oh, well, I have to cure this and it has to go away and I never have to have it again. Is just going, yes, this is something that is now part of my life, and I'm going to do the best that I can to manage it. So in terms of management for IBS, we've got our diet therapy, which I'm going to go into a lot more detail on, lifestyle therapy, and again, I'm going to go into detail on that. Psychotherapy is another huge component of irritable bowel syndrome, and some really interesting studies coming out about the influence of psychotherapy. So being things like gut-directed hypnotherapy, cognitive behavioral therapy, mindfulness and meditation. Really, really interesting space there, and something that I'm sort of diving into more with my practice as well is sort of looking at that mindfulness and meditation, and our programs are including a lot of that aspect of it, and it's having really, really profound effects. So yeah, really interesting, that space. We've got our pharmacotherapy, so that's medications. Most people don't go on medication for irritable bowel syndrome, but there certainly is some medications which are useful, particularly in irritable bowel syndrome that has been non-responsive to other therapies. We sort of use that as a dietitian, we sort of use that as a last line approach. Again, can't prescribe medications, but we would refer back to a GP that might look into different types of medications we can use. Supplements, so we're looking at things like probiotics, fiber supplements and whatnot, can be quite useful. Not all that beneficial, depending on the type of IBS and the symptoms presented. A lot of people, when it comes to IBS, their first thing that they do is go and get a probiotic. But unfortunately, it's not that simple. And when it comes to IBS, there is a couple of probiotic strains that are beneficial. But when I say beneficial, it's beneficial in some people. It's still not one of those things that we can sort of say is, okay, we'll take this strain of probiotic and you're never going to experience symptoms again. Personally, I found them quite hit and miss when it comes to probiotics. Even the strains that have been proven to be clinically effective in IBS, still quite hit and miss, and usually work better in combination with the other therapies. So the lifestyle therapy, the psychotherapy, the diet therapy as well. And then finally there, we've got physiotherapy. So for things like chronic constipation, physiotherapy can be incredibly effective and is something that a lot of people I don't think know about. So I think it's really important to touch on physiotherapy there being a type of treatment for IBS or a way to manage IBS, because it does help give relief to a lot of people. And it can be a bit confronting going to your physiotherapist about constipation, but a pelvic floor physiotherapist is a fantastic resource if you have chronic constipation as well. So yeah, in terms of management, what you will typically do is a combination of all of these. So it's not about sort of going, oh, I'm only going to focus on one and not worry about the rest. It's about finding the balance of all of these different types of therapies that works best for you. The other thing is to know with IBS is what works for one person is not going to necessarily work for the next person. And this is one of the most frustrating things with IBS is that you know, your best friend's telling you that, oh, well, I did this and it worked perfectly for me. And you have all of these hopes that it's going to work for you, but it has absolutely no benefit. That's quite normal and expected in IBS, that what works for one person doesn't work for the next. So what we teach in the program is like a system where you can go through and work out what are the things that are going to work for you and what's not going to work for you, because there's going to be things that work and things that don't work. And it's not expected that it's going to be the same for the next person as well. Next slide. Okay, so let's start with lifestyle therapy. So when it comes to lifestyle therapy, these are some of the first line things that we will sort of look at when somebody comes to us with irritable bowel syndrome, is making sure that their lifestyle is a lifestyle that is going to support the management of their IBS. So first and foremost, including some sort of exercise in their life is very important for anyone, but in particular IBS that is associated with constipation. Keeping it moving is important to keep the bowel and to keep you regular. A lot of people with diarrhea predominant IBS worry that exercise is going to aggravate their symptoms. And so what we'd suggest there is to do a little bit more gentle exercise. So not as much high intensity. You might be better off doing things like strength training or yoga or Pilates as opposed to running. Yoga is incredibly effective when it comes to IBS, and one of the reasons we sort of think this is because of the effect that it has on the gut-brain axis and regulating our nervous system. So bringing us into a state of rest and digest as opposed to our sympathetic state, which is our fight or flight. Yoga is very effective at regulating your nervous system. So including yoga as part of your management of IBS is something that I personally recommend to as many of our members in our program and my clients as well, because of the effects that it has on the gut-brain axis and in IBS. There is some really exciting research in this area as well, showing that yoga therapy is equally as effective as the low FODMAP diet in managing IBS, which I think is just insane, because if you think about the low FODMAP diet, it's a very restrictive diet and it's really quite effective, but it's a very restrictive diet. If we can get the same from doing yoga, then why are we not doing yoga more often? Like, this is incredibly powerful if we can, you know, have a freer diet and, you know, there's more freedom with all of that. And all we have to be doing is yoga a couple of times a week. I think that's, yeah, so powerful. I could talk about that for weeks. The third one there is stress relief. So stress is a big trigger of irritable bowel syndrome for a lot of people. And in particular, what I found with my work is that a lot of people who experience irritable bowel syndrome really do fit a personality type. And not everybody, but a lot of people fit this personality type of like the perfectionist, the highly strung, the everything needs to be done a certain way, the busy go, go, go kind of person. And stress relief is such an important aspect of that. And I fit that personality type as well. So I can vouch for stress relief being not only good for your body there, but also for your mental health as well. But for those people, managing your stress, so be that managing the stressors or having healthy outlets for your stress, is incredibly important part of managing your IBS. And again, can be a part of managing your IBS, which means that you don't have to go on restrictive diets, because you're able to manage your symptoms through managing your lifestyle, which again, I think is much more beneficial than having to cut out lots of different foods that you don't need to if you get on top of your stress. Easier said than done always with stress management. The final one here is sleep. So having poor sleep is linked with worsened IBS symptoms. So again, tying into the whole stress cycle here, is it's really important to aim for about 7 to 9 hours sleep each night. And obviously we'd like that to be undisturbed sleep, hard with little ones or with highly stressful jobs or anything like that. But prioritizing is an important part of managing IBS. So be it, switching phones before bed, not working before you get into bed, not being active, late in the evenings, not drinking too much caffeine at night or in the afternoon. Really important to prioritize sleep as well for IBS. Next slide. Okay, so the next thing that we'll go through, and I'll just touch on these ones because I could talk about each of these for a long period of time, but the approach for therapy in irritable syndrome is to look at some of the key. So another step that I feel is often missed by a lot of people, when they go into their doctor, they're told just to go straight onto the low FODMAP diet as soon as they're diagnosed, and are sort of overlooking some of these key triggers which prevent them having to do a restrictive diet like the low FODMAP diet. So first and foremost is making sure that the person is getting adequate fiber, but not having excessive amounts of fiber. And when I was going through my training as a dietitian, I never thought I would have to say to people to not have as much fiber as what they're having, but it's something that I'm seeing more and more of, particularly with people who follow plant-based diets. I've seen people having upwards of sort of 70 to 90 grams of dietary fiber a day, with the recommendation being about 30 grams a day. So up to 3 times the recommended amount of dietary fiber. And having so much dietary fiber can will increase the fermentation in your large bowel, which obviously in somebody with that hypersensitivity in their gut is going to develop more symptoms. So it's about having the right balance of dietary fiber there. Then there is managing caffeine intake for people with diarrhea predominant IBS in particular. Caffeine can be quite a big trigger, so being mindful of the amount of caffeine and the timing of caffeine, but it can be quite useful to consume caffeine for people who have constipation predominant IBS. Alcohol is the third one here. So alcohol is a stimulant to the gut, an irritant, to the gut, and can increase the frequency of bowel movements. So a lot of people will experience the day after having large amounts of alcohol, an increased frequency of going to the bathroom. And in particular for people with IBS, that is sort of that day after, so it can go for many days after. Fat is the fourth one there. So having large amounts of dietary fat, be it healthy fats or a less healthy fats. So things like even avocados and extra virgin olive oil. So these really healthy fats can still be a trigger for some people. A lot of people find when they do have really high fat meals that they are going to the bathroom more frequently as well as experiencing more symptoms like cramping and abdominal pain. So adopting a lower fat lifestyle can be more beneficial there. Protein, this one is a big one for people who have really high protein diets. So a lot of people who are like into their gym, so like things like bodybuilders and whatnot, who are having lots of protein shakes and everything, then we can look at managing their protein intake. So still having adequate protein for their goals, but making sure that we're not going above and beyond, and that we're supporting their protein intake with adequate dietary fiber, so that we're not getting excess fermentation of protein in the bowel as well, which can lead to quite smelly farts. Number 6 is artificial sweeteners. So the sugar alcohol sweeteners in particular are quite a big trigger for people. They're poorly absorbed in most people. So excess consumption of artificial sweeteners, in particular, like I said, the sugar alcohol artificial sweeteners is going to cause digestive upset for most people. But again, in somebody with IBS, that high sensitivity, it's going to go above and beyond. So, opting for sugar-free products is usually a better choice than choosing the products that have sugar. But in particular, things like protein bars and protein ice creams and sugar-free confectionery are sort of the big ones here that we see that these sweeteners in, and chewing gum as well. Meal size is a really important one. Reason being is that when we have a larger meal size, obviously we're going to have a larger bolus of food moving through the digestive tract. So more for the digestive system to have to work through and break down, and more likelihood that in that hypersensitive digestive tract that we're going to get some sort of signals of pain or alarm signals being sent to the brain to say, hey, this is too much for me to handle, send some pain signals, please, light up the pain centers in my brain, and we get that miscommunication happening there. So for irritable bowel syndrome, the suggestion typically is to have more frequent meals, but smaller meals, so that you're not sort of going hours without eating and then having a massive meal. Keeping them to smaller portion sizes more frequently throughout the day is typically the most beneficial thing. Some people say that they like to intermittent fast with IBS. I find it very hit and miss. So some people will have benefits from it, but other people will actually make symptoms worse. And in particular, I find with constipation, it tends to make it worse. Having breakfast in the morning is quite beneficial. Spicy foods can be, again, another irritant for the gut. So for people with IBS, having things like curries and chili and all of those spicy foods are likely going to increase the speed of their digestion and increase the symptoms they're experiencing. So we tend to say go for milder foods or avoid spices and use things like herbs and rather than using chili and spices there. And the final one we've got there is lactose. So lactose being the sugar component of milk or cow's milk or dairy milk. And a lot of people think that they need to go dairy-free for their IBS, but typically it is the lactose component, not necessarily the dairy component of or the dairy protein component of dairy that's causing issues in IBS. The symptoms that we would typically see here are things like abdominal pain and cramping and diarrhea. Constipation is not so common when it comes to lactose. So if you're constipated and struggling to go to the bathroom, it's probably not going to be lactose that's the problem. But the simple solution there is switching to lactose-free products. Next slide. Okay, so once we've done all of that with those first line strategies, if we still haven't seen adequate symptom relief, the next thing that we move on to is the low FODMAP diet. So the goal is essentially that we don't have to get to this point. And that is one of my big my big strategies that I use with all of my patients, with my programs and everything, is let's see how we can avoid going on this diet. Yes, it's incredibly effective, but it also sucks at the same time. So I want to make sure that only the people that need to go on it are going on it. And then we get them, in and out and doing it properly when they're at that point. So the low FODMAP diet, the aim is to work out which of these FODMAP foods, so FODMAPs being fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, so types of carbohydrates. And the aim is to work out which of these types of carbohydrates are causing symptoms for you, so they are triggering your gut symptoms. There is a lot of different foods that fall into these carbohydrate groups, so these FODMAP groups, and most people, and in fact, I don't think I've ever had somebody who is symptomatic to all of them. So most people will find that it's only one sort of group of them or two groups of them that they're getting symptoms from. So it is really important that we sort of do the low FODMAP diet in a really strategic manner, so that we can work out, okay, which ones are the ones that are triggering your symptoms, how much of that FODMAP do you have to eat for it to trigger a symptom, and how much can you actually safely tolerate? Because what we want to do is to get you eating as much, like as freely as you can, and as much of the foods that you can without causing symptoms. Because we don't want people having to spend the rest of their life being restricted from food when it's completely unnecessary. So break it down in 3 parts. So we've got the elimination. Typically, I don't run for more than 3 weeks. I think if we do it properly, we can get in and out in 3 weeks. Some people will take it up to 6 weeks or even longer, but I don't recommend it. I think you're better off going, hard in and hard out. Then we've got the reintroduction phase, which is where we one by one introduce those FODMAP groups to try and identify, like I said, what it is that is the one that's triggering and how much of it. And then the part 3 is the personalization. So that's just finding your healthy balance, your healthy medium at the end of it, and making sure that you are having a healthy diet as a result of that. Next slide. So what are FODMAPs? I think I've already touched on that, but the key point there is that it is found in many healthy foods. And a lot of people will say to me, well, I started eating healthier and I noticed that my symptoms got worse, and FODMAPs can be the reason for that, because they are found in a lot of fruits and vegetables and whole grains and legumes as well. So a lot of people will find that when they do eat healthier, unfortunately, they do get more symptoms, which really sucks. But again, it's another reason to do this properly and to work out what are the things that are causing them the symptoms. Next slide. So how do FODMAPs actually cause these symptoms? So there's 2 sort of ways that they cause the symptoms. Is one through malabsorption. So FODMAPs are not well absorbed in all humans. It's not just people with IBS. We don't digest them and break them down very well. And they then go through to the large bowel, where they can draw water into the large bowel. So this is where it can cause some cramping, and it can also cause loose bowel movements as well. The other way that they can be through fermentation. So FODMAPs being fermentable, they have to be broken down by the gut bacteria that is found in the large bowel. And so this fermentation produces different types of gases, which can then cause bloating and distension, and again, cramping and discomfort as well. So it's through a combination of this malabsorption and fermentation that we see FODMAPs being a problem in some people. And the reason why people with IBS do have this problem is because of that hypersensitivity again. So it's not that FODMAPs are reacting any differently in that person's body to somebody who doesn't have IBS. It's just that it's causing symptoms for that person. Next slide. So this is just a list of FODMAP-rich foods. I won't go into it, but as you can see, there's quite a lot of them, and again, quite a lot of healthy foods. Next slide. Okay, so what else? So this is just touching on some of those other types of therapies that you can look into for irritable bowel syndrome. So like I mentioned earlier, pelvic floor physiotherapy is really, really effective for chronic constipation. And in particular, if you've had it for some time, your muscles can be, I'm just trying to think of the right word, you're not regulating the use of your muscles, you're not coordinating, sorry, the use of your muscles in your bowels appropriately in order to evacuate a stool. So pelvic floor physiotherapies can be incredibly effective in helping you to retrain your bowels in order to evacuate stools appropriately. So definitely something worth looking into. And in particular, if you experience pelvic pain in association with your IBS, which is something that's a really common condition that sort of overlaps with IBS, is chronic pelvic pain. Supplements and pharmacotherapy. So the different types of supplements and drugs that we can use in IBS are things that manage our symptoms. So things like antidiarrheals, antispasmodics, They are sort of the main two ones that we'll see used, or laxatives as well. They're like the main ones that people will use just to manage symptoms. And there's different types there that you can use for medications, and also more herbal things. So like peppermint oil is a really common antispasmodic and quite effective in dealing with stomach cramps. We then have our fiber supplements, so things like Metamucil and Bene Fiber, which are useful if you're struggling to get in dietary fiber, or if you're needing to modify your stool form. So, for example, if you're needing to soften your stool, if you're needing to bulk up your stool, it can be effective and something to work with your dietitian on. The other one there under supplements and pharmacotherapy is antidepressants. And this is one that is really interesting because of the way that it acts on the gut-brain axis. A lot of people do have a lot of fear around using antidepressants in irritable bowel syndrome. But the thing here is that most of the time it's not used until, again, it's sort of like our last line therapy that we use here, these antidepressants. And typically it's a tricyclic antidepressant, and it's used in a dose that is actually quite small. So it's not actually in a dose that would be effective to act on the brain and actually act as an antidepressant. Rather, it's acting on the gut-brain axis and helping to sort of calm down that gut-brain axis and improve the communication between the gut and the brain. So yeah, to answer questions about the use of the antidepressants there, the dosage that you're having when you're using it for irritable bowel syndrome is, I think, about 1/10 of the dose that you would use if you were using it as an antidepressant. So it's not acting as an antidepressant. And the third one there we've got is gut-directed hypnotherapy, which is a really exciting area of research, again, looking in how we can sort of manipulate the gut and the gut-brain axis through gut-directed hypnotherapy. There's not a lot of people out there doing it properly. So what I would suggest is to do your research and find somebody who is a psychologist trained specifically in gut-directed hypnotherapy, so that you are getting the appropriate treatment that you need for this. But it is an evidence-based strategy for managing IBS, and it is quite effective in doing so. Again, if dietary therapies have not given you any sort of relief, it's a really good line of treatment to go down. Next slide. Okay, and finally, I think I'm actually doing well. I'm so surprised. Finally, eating for a healthy gut. So this is more so about what do we do to eat for a healthy gut microbiome. And now this is a whole nother topic in itself. But what I wanted to touch on is, like, what do we actually do in order to make our gut healthy? Because there's a lot of misconceptions around, well, we have to cut out gluten and we have to cut out dairy, and, you know, we have to do all of these things, take apple cider vinegar and probiotics in order to have a healthy gut. But in order to have a healthy gut, we do just need to do some simple things. So I'm just going to go through a few of those simple things that we can do to improve the health of our gut and our gut microbiota, which is going to improve our overall physical and mental health as well. So what we've got here is, first and foremost, and I'm not going to go through them in any particular order, but including at least 30 grams of dietary fiber in your diet each and every day. To have a mix of different types of plant-based foods. So rather than, you know, your broccoli and carrot every single night, is to try and mix it up and have different types of vegetables, different types of fruits, different types of grains and nuts and seeds, so that we are getting that diversity when it comes to the types of fibers that we're having and the types of nutrients that we're getting that are impacting on our gut. The other thing I always say with this is look for different colors as well, because different colors of fruits and vegetables are going to have different phytonutrients, which are going to act on the gut as well. So yeah, having, you know, blueberries and strawberries and broccoli and Brussels sprouts and carrots, all of those different colors is going to be beneficial for your gut, as opposed to just sticking to white potato and cauliflower. Including healthy fats from omega-3s. So these are the fats that we will find typically in oily fish. So things like salmon, tuna, mackerel, sardines. You can find them in some plant-based foods in things like chia seeds, flax seeds, and walnuts. It's just a slightly different form, and we have to then convert it over. So I always say that the oily fish is the more beneficial thing to go for, but if you're vegan, then having plenty of those plant-based sources of omega-3s is great as well. Limiting saturated fats. So saturated fats being found in our animal-based fats, so the fats that we see in meats, so fatty cuts of meats, as well as butter, dairy products, and also coconut oil. So keeping those to a minimum and choosing more unsaturated fats, so things like your extra virgin olive oil, your nuts and your seeds, your avocado, are much better sources of fats. Drinking plenty of water, obviously very important for our digestive health, because our digestive system needs water to flush everything through. And one of the roles of our large bowel is to reabsorb water. So if we're not having enough water, our digestive system cannot function. And actually, I just realized I probably should have put that right at the very beginning of the lifestyle therapy. If you're not drinking enough water and you've got IBS, start there. Limit alcohol intake and also avoid smoking. So both alcohol and smoking cigarettes are going to be a irritant on the gut, and can cause damage to the gut long term as well. Can increase the permeability or the leakiness of the gut. So it's really important that we are drinking alcohol in moderation. Don't have to completely avoid alcohol altogether, but in moderation, absolutely, and avoid smoking if we can. The final one I'll touch on there is fermented foods. The evidence is mixed when it comes to fermented foods and gut health, but I always say that there's no harm in consuming fermented foods. Some people with IBS will too many fermented foods, so things like kimchi and kombucha are going to increase their symptoms. So if that's the case, then don't have too many. You don't need to have them in your diet. But if having things like live yogurt and kimchi or sauerkraut are sitting fine in your digestive tract and you're not getting any upset symptoms from it, then it's worth including them, I think, because they may have a benefit. We don't have the science to back that up yet, but let's try it. If we've got them available, let's give it a go. Next slide. I think that might be us done. Yes, so this is just where you can find us. So I'm at Gut Started on Instagram, so at Gut Started. Or my personal account is just my name, which is Marika Day. Our Facebook page, if you just search Gut Started, you'll find us there. And our website is currently just a landing page. It's going live next week. But you can sign up if you go to the website, you can sign up to get updates on that. So we will let you know once it's live. And we have some really exciting things coming on that new website and the new brand there as well. So I look forward to keeping you all in the loop.
Thank you so much, Marika, for such an informative session. Now, the Q&A has been going off right now, so I've got a few questions that some of the community have come through with. One of them was from Nina, and she has asked, can food poisoning trigger IBS?
I don't think there's much research around food poisoning per se, so the bacteria that we would find in food poisoning, but it could potentially fall into the category of post-infectious. So when they've done research on post-infectious IBS, I'm not sure whether they've sort of pulled out like what infections are we specifically talking about, like does food poisoning fall into that? So potentially, but yeah, I haven't heard specifically that food poisoning does, but like I said, it could fall into that category of post-infectious, but yeah, I'm not sure, unfortunately, sorry.
No. And then the next one is, for constipation or gut health, are colonics a recommendation?
Yeah, good question. I don't personally recommend them just because of some of the risks involved in getting them done, and some of the clinics where they are being done are not being done by trained professionals and everything. So I think that the risks of having them done is greater than the benefit that we get from them. There is a lot of strategies that you can use to manage constipation from a dietary and lifestyle perspective. So even things as simple as like creating a toilet routine, sitting on the toilet with the correct posture, modifying your diet. Obviously, there's lots of different things you can do with your diet. So I think that it's something that, again, like I said, I wouldn't recommend. But if you are going to do it, make sure that you've done everything else first.
Yeah, and your research as well as to where to go.
Yes, absolutely.
The next one is from Elizabeth, and she said you mentioned caffeine for dietary therapy. Do you mean that people with constipation predominant of IBS should stick to 1 per day, or for both types? And is this also tea or just coffee?
Great question. So with caffeine, for people who have got constipation predominant IBS, I actually recommend it as a laxative essentially. So if you find that caffeine helps you to move your bowels, use it to your advantage, because there's no harm in consuming caffeine. In fact, having coffee, it has been shown in multiple studies to be beneficial, in terms of our heart, our cardiovascular health, our our mortality rates, everything. So if coffee helps you go to the bathroom, fantastic, use it to your full advantage. But if it, like I said earlier, if it's in diarrhea predominant IBS, if it's causing you to be going to the bathroom and multiple times, and loose stools that you can't control, or is causing cramping and pain, that's when we'd look at modifying your caffeine intake. So reducing it down, going for caffeine-free, decaf coffees, caffeine-free alternatives. Does tea fall into that category? It would depend on the individual and how sensitive they are to caffeine. You can obviously get caffeine-free teas, but I haven't personally seen many people who do get a response from caffeine in tea. It's not very strong, the amount of caffeine in tea. It tends to be more so the people who are having multiple coffees a day and going to the bathroom all day that we need to look at the caffeine intake.
And reduce it just a little bit. The next one is from Beck, and she said, can having gastro a few times in your life cause IBS?
Cause, I'm not going to say cause, because we don't really know what causes IBS. But I would say that it would be one of those things that I would put you in a higher sort of risk category, just because of the frequent infection. So you could have potentially developed, a post-infectious IBS along the lines there. The other thing is, IBS is such an interesting condition. I find it so fascinating in terms of what's going on here and the history of people who do get IBS. And a lot of people do frequently present with low immunity. And so that's something that is it because of that you've got the frequent gastritis, sorry, not gastritis, the frequent gastro infections? Is that because of low immunity that you potentially have got in combination with the IBS? It's chicken or egg, I don't know.
It's a very complex, like you said, IBS is so complex. Everyone is different. They just keep coming. Another one, if one is diagnosed with fructose malabsorption and lactose intolerance, but has no abdominal pain and cramping, does this mean they might have IBS?
Not necessarily. So you can be lactose intolerant and have fructose malabsorption and not have IBS. So they can be completely separate conditions to irritable bowel syndrome. So if you don't get any abdominal cramping or the other symptoms of IBS, it's just lactose, you go to the bathroom, that would be pretty straightforward lactose intolerance. And the same with the fructose malabsorption. When you consume foods high in fructose, if you are, be it vomiting or going to the bathroom or whatever it is, pretty straightforward fructose malabsorption. The only thing that I always say with some of the testing for fructose malabsorption and lactose intolerance is to be mindful of your personal symptoms, because I've had a lot of people who have been diagnosed through colonoscopies and endoscopies with lactose intolerance, for example, saying that they don't have much of the enzyme in their system, yet they can tolerate lactose perfectly fine. So base the intolerance on your symptoms, because it's not going to be doing damage to your gut by consuming it. So if symptomatically it's not having an issue on your gut, then consume the lactose. And the opposite is true as well. Like people who have had gastroscopes and have said that, you know, their lactase enzyme in their gut is absolutely fine, yet we give them a half a glass of milk and they're on the bathroom. I'm like, oh, something's not right.
Something's not right. And then last question for today. How does magnesium assist with constipation, and how much is required to see an improvement?
So magnesium is one of those supplements that we can use as like a laxative, essentially, because it is not absorbed, because it draws water into the bowel. It can help to soften stools and to be used as a laxative, essentially. The amount that people use will be based on the individual, and I don't feel comfortable giving out recommendations in terms of the amount used here, but work with your GP or your dietitian and speak to them about what is the most effective dose, or is that the most effective laxative for you to be using. I use the term laxative loosely there because it's not technically a laxative, like it's not stimulating the gut or anything. But there's lots of different supplements that you can use in constipation. So things like the psyllium husk, things like magnesium. You've then got stool softeners. So that includes things like Movicol or Movicol, however you want to say it. These are not necessarily laxatives because they're not actually stimulating, or they're a laxative, but they're not acting on the gut in the fact that they're stimulating and they're making the gut become reliant on them. So they're a much safer laxative to use. So yeah, it's a bit of trial and error as to what works best. But again, I would suggest these as relief when you need them. But what you need to be doing is working on what lifestyle strategies can you make sure that you're doing to sort of support you to, and then use the laxatives where required. And that's not to say that you won't need them. Like a lot of people think that, oh, well, I should never have to use laxative and my diet should be able to fix all of this. That's not true for some people. Some people will be on laxatives for a longer period of time. And I think there's a lot of stigma about that. I think it's okay, you know, provided that you're working with your gastroenterologist, your GP, your dietitian, to make sure that you are doing the things that you need to support and sort of give yourself the best chance in terms of the lifestyle and the dietary therapies. But if you do need to use some type of laxative or supplement in order to make your life easier and more comfortable, that's not a bad thing. And like I said, as long as it's not doing any negative effects, or the risks and the benefits, you know, the benefits outweigh the risks, then yeah, by all means, I think that it's an important thing to include, and there shouldn't be stigma around the use of those things where the benefits outweigh the risks, and that's going to be an individual case-by-case basis.
Thank you so much for your time today. And for those who do want to follow along and learn more about Marika and the Gut Started program, you can actually head to the website, and in the exhibitor section, Gut Started is actually there, so all the social links are there. So thank you again for your time today, Marika, and have a lovely afternoon.
My pleasure. No, thank you. I've enjoyed it.
Thank you. So I hope everyone enjoyed the lives today, and that concludes the first of Australia's Free From an Allergy virtual show. Thank you to all our presenters over the past few days. You guys have been amazing, and make sure you check out our Facebook community, which is Free From an Allergy Community. So there are so many people in there that are suffering from intolerances or have lived experiences where you can actually connect with them and share as well. Make sure you check out our new YouTube channel, where we've actually partnered with Coles to launch a new series called Living Free From, and we've got Master Chefs Danny, Courtney and Michael who are creating allergy-friendly recipes, and there's new episodes that will be launching very soon. And lastly, make sure you check out the exhibitor area, because we've got some amazing allergy-friendly products out there that we recommend and love. So make sure you go and check them out, and then go look in the content library, because there is a wealth of knowledge in there. We've got access to specialists who have provided really informative informational videos, that touch on various aspects such as gluten-free, dairy-free, vegan, FODMAPs, whatever it is, we've got it there in the content library. And regularly keep checking on it, because we are putting new content on there on a basis. And lastly, thank you to the IEC group and the team for putting this amazing show together. We cannot wait to see what the future entails. Stay connected with us because this will not be the last of our virtual TV series. We've got plenty of projects in the works. So thank you again and have a beautiful weekend.